Ali malungilitasil se maldi ngartiang yamrang asulir baklaad mga rablo oryor makmal ngutel susan sanga atangak lekol libdul mabilung dire kalmal raklay maybe raklay mal lungilitasil se mal kora ngilan ngutsel ngartiang betok aldadu matay del cook section ADB sponsored presentation as well as a program. Ingartiang yamal recognize beklaat. First of all, Honorable and His Excellency ang kale President Tergida di usat longled, but our Madam Vice President Ngartiang malming asulim Vice President active participation. Dili kalmal mirang asuli bekal ministers, Minister Finance, Honorable Caleb Oduy Jr. Dili kal Mr. Babira igale ministers, Minister Ngirait Matul. Dili kal mesang tara igale sponsor igid His Excellency Ambassador Shabal, Ambassador Karasawang Ngartiang. Thank you very much, Ambassador. Diri kalmal ngutel teale recognized Deputy Director General from ADB Pacific Department, Emma Veve. Thank you very much for this afternoon. And I would like to take this opportunity and just give an overview of the COVID response for affected poor and vulnerable people. I think so much has been said. So what are we doing right now? We thank our partners, UNDP, and IMF, World Bank, ADB. And so we're so lucky that since 2021, it's been signed that we have direct assistance to those who are of our community who are vulnerable and who have been impacted the most, just as we are all have been. But we've been impacted. So the assistance is, the total package is just 3.7 million. It's spread throughout 3 outputs. And I'm happy to say that this has been here for the past, since this morning. So we've had an opportunity to see what are the specific outputs. But the overall outcome is the capability of poor and vulnerable households to withstand further impact of COVID-19 improved. Seldo southern Torbela saying ngeso malubeng amrul ol ngesewa albul maalitut la alsela blu mother staloblil ilkidam lo amaw ilgirel tial ilseera tora pandemic COVID-19. So the first outcome, the first output is the welfare support to highly at risk elderly and persons with disabilities implemented. Implementing agencies, Ministry of Health and Human Services. Our service providers are Palau Wellness Center. What are the specific activities that they've been doing in the past year? The second one, I'll just go with output 3 because it's also with the Ministry of Health and Human Services. It's the multidisciplinary responses to address family and gender-based violence implemented. From a representative, Rangkale Bango, our ambassador, Rangkale Santi Asanuman, Mortiang Direcan mo ukti discuss which is social marketing for gender-based violence. Unfortunately, no dakal sabel ang representative rasam sa milak organization, but they are providing services to family and gender-based violence victims. So it's a direct support. Their doors are open. We have their cards at the back. Nga phone number there. Matsukumo ko mumdaso kasi nga adalo spe angya so elgirela osob aklela ngidil toil ngiyam lo itutin ngiyam do swel marang ubang alevton mara padengel segida sabe edel lom godong ngiye to ko oreli de tirige orelo mentir other Ministry of Health Musel Family Protection Act working group which Vice President is leading as well. So sige look output 3. And then for output 2 is implementing agency, malbring leader Bureau of Agriculture under the Ministry of Agriculture and Fisheries and Environment. Olo di mo kanya Palau Visitors Authority. Tirgay kuk implementer sa food security and income generating support implemented for small-scale agricultural producers. SSL direct assistance that is from the Japan Fund for Prosperity and Resilient Asia and the Pacific. Ngariya food processing manager ngartang chodin only aramang sao ngay daw kumski the presentation niyo what are we doing thus far. Sige sel mobile of L SL next after a panel, we're going to be actually awarding. That is the hope. That is what we're here for. That is what we're taking 2 to 3 steps. Ulagad man mas tadira aldobe el ngartiang. So ilbol mo ito tarang mamalada loader obvious and bulot. Ay dito de mong makimong ado urtin mo kad mong danya kasi adalom las el mukro ling mo kalya tara club saying mo sabe de lotrur mo sabe el galle lang algi tara club say. So sige da kad mo award the 12 aldobe already going to award our 6. We're going to be awarding 12 today. So give mal nimbre nga sulyar beklat trigal aldabel and thank you Vice President always for highlighting the importance of our mothers, our women, and our fathers and our men. So hindi more sayigid and I will hand it over to BWC for output 1. Thank you.
Will swell begim lelding le mga law Vice President Senator Mario Minister Matur Spedingal Ambassador sa kama maadar ong law the team ong law the nganitel team ong law the lura ADB team ong law gore ngania tul team alsel ngania team oltoy ringol leader nga Edward team Perlu nga kana mo adaraban de Vice President mo adara alitak mga maluisa mauera abok seperti tiagi del serder sing tiangana lurior en seguido saber nga maget aquí parte tiagi del social development trablur belau en aquí de kalol tour nga malotorang pardo coming I need to speak English. I forgot. I was so excited to see all the Palauans here and share what we've been doing on the ground. But hi, my name is Pearl, and we're from Palau Wellness Center. And this is an NGO with Dr. Yano Joel Toribio and Dr. Chris Kitalong. And we've been working on the ground for the last couple of years. We've been fortunate to work with Minister Udoy to give us this money from somewhere so we can go to this household. And with me today is Vanessa, Nurse Vanessa. She's our champion on the ground from Ministry of Health Homebound. And with me today is Mr. Baat, urban grower expert, urban gardening from Gore State. And then there's Edward, the superstar. And then there's Luis, another superstar. Woo! And then I have with me life coaches, and there's Miss Carmela and Miss Imeala. So there's 35 life coaches that are licensed to teach wellness everywhere in Palau under CDC standards. So we're very fortunate to bring that from a work site community into an individual home when there is a vulnerable population and people with disability. So there you go. Next slide. So we have an actual opening song. And this is what we do when we enter the homes. We use music as a segue in to see what means. So I would ask the audience to stand up because you've been sitting and talking about a really heavy topics like money or where to find money. I don't know, but just everybody stand up and ladies and gentlemen, Edward and Luis from Palau.
축축해. Abdul mais mangur mamadam omaraka aulum madalega ma imma barabare la im awa amap kula mabrobara olta lada lebok sa orak mesisi elek paleo beltangko Abdul mais mading mangor mamadama omaraka Haulum madalega ma imma barabare la im awa amap kul mabrobara olta kara alada lebok orak mesisi elek paleo beltang. Last one. Abdul mais mading madma omaraka haulum madalega ma imma barabare la im awa amap kul mabrobara olta kara alada lebok torak mesisi elek beleo beltang.
Thank you for participating with us. This is what so this is what the segue into the homes, and there's about 200 plus homes that are classified as homebound and people with disability that are listed within the Ministry of Health. And that project under ADB is exclusive for that, with an exception of community health wellness that are targeting communities that are in Babaldao and Yoldao that's not in Koror. So the services is music and arts, urban gardening, life coaching, home improvements, community wellness. And we got deployed in August 15th, and we've already cleared homes from the Ministry of Health homebound, where Vanessa is a very key component for this project, was they clear the homes for the social services for us to, for the home household patient family members able to welcome the social services. So next. So I asked them to do the presentation, but they said we're going to sing. So music is medicine. So we're not going to be very technical about it in terms of how the brain works and the chemicals and whatnots. But when you look at that, we have a guitar and singing. And in the center of that circle is a patient, family, and caregiver. So those are the three components in a household that when the project goes in, take a particular attention to. And how it works is the brain and body works. The benefit goes to the patient, who's probably have a very limited mobility, and also the caretaker, who has more mobility, and the family members. It may be uncle, aunties, relatives, children. They all receive that services. So when Edward and Louis start music and singing, what happens, we see the first thing that we see, they start smiling. And then they start dancing. And now they're singing. So because it's very clearly evident that the more visits that we give, the frequency that the patient or the household requests the services, the more improvement we see particularly for the patient. So when we know that we provide that movement and that joy in the household, that 1 hour or 30 minutes, whatever time they were there, it improves mood, the patient mood. So when we leave, they have a little bit of happiness to tackle their daily lives. And so musicians are healers too, and music is medicine. Alitak mo ang ala de minister akar. So, we have a lot of video because it's a part of our study, but we just show the pictures. And so that's Edward, and that was yesterday or something. That lady is 104 years old. Wow, I know. You want to be 400 years old and still sitting and rock and rolling? Yay! Next slide. So I would yield this slide to Baat. Baat is the guru of urban gardening in Koro State.
Ali? Yes, okay. Good afternoon. Vice President, kultur kaya di ko ngado ato ko rebelaw. Kagi dami ni start betul bal kumak kora mo ngado eng subel mo tuya ka sulamin ni start betul. Bago mo laura nga sulirar wapper la Mabela Wellness Center. Wal ko ragi lagay gingutel urban growers program na Koro State tel mo sisibi kung maso amal cook service sa trigel over 100 tel disability para sila blur orior. Tiagi tatele la urban gardening kar di wasel other check plus you are what you eat ngegi del basel 104 dire kalmal sisi ilaw sers dire kalmal ngila sersera na pa mga yung brak plus skum mang sa ml dol niya local roli ang apmal mo ngilem sisi apa tangem Vice President, tumatiagi na ako na la reram. Agi mosoy sa brablay. Mo magi agi del kaldel patient caregiver ma familia. Agi mo lo sis akartir plus yung wagara la dolal morngi. Wagara silbo do sigratan niya kada bang urager. Mang duro sa kita giukle partner ka mama Palau Community College Cooperative Research and Extension. Madirekal Taiwan Technical Mission, Madirekal Bureau of Agriculture. Ang aygal tingin la director ang katakal director of BOA. Colin Joseph magsubes ng hindi bla kalulura Koro State agyobes sarang klel magsubes say obesa din do olema kora del kitangis so mang agidro segidel kora relationship per kamap to provide ako training and meron ma'am wayal at trainer simla train self gigora obasil train the trainer training musaya gi mongot pokering ma'am ela sa mamal musiba sers malalma amasay malalma sers sa amal ko damal mang ay kita available services sa state mang sel local perlal magi top dal magyol ko sir obli lesel ko kimoral agi palugilar ma'am legel obli lawal ko ram lamon niya skills manalit silbal acquire mo sisilta ma'am la elevator cell level ra cook household maselbol increase sa focus ma attention ang mogi ka stress leko alta ka uro rakla sa habyo ko lingi kamla mo oksigi mag kurre ede apa minister obiang I say akti kora ngusay gide o ay sila kamit plus yung lamoriak level dart el blag iblam surbring rablur orior yung duro ay gagidil kora partnership sa kora dalawil gagidil kal namo uro labang kala palaris magina mo plus yung ger al sila rablur orior Sabay the low shares, sabay the low masay, makmal, dito ka low ring asula la Ministry of Finance, ilko kirel sa igid ilkora, te alag dalbas ka ma'am. Sel mamang koralas tertial circle, sel functional medicine, direkal, tiada kadil kora, idungul biya, direkal ngulme, suburik plus at yung makaraom kukuringi, in a nutritious way, o sisil tamang madakada, depende rangel import del mesoy saba. Makaduk sa baedel mugulay sila agriculture economic side tayo gidel hime mga tukkarngi. Ang kora dim lagi gide senator sa ngabawe ako man sulang.
Yes. So now I'm urban gardening expert, and I didn't know that Minister Obiang has a tapioca farm. So, urban gardening, in a summary, is transfer of knowledge from the expert that goes to the household and teach the caregiver or the patient with a little bit of mobility, or family members that can learn how to plant and maintain and harvest those vegetables. And at the same time, that transfer of knowledge becomes a stress management, particularly for the caregiver and the kids. We see kids coming out and really enjoying planting and harvesting. It becomes a functional medicine. So it's a functional medicine that not only solves nutritional value on the table to that particular household, but it also elevates the other activities like how to learn to cook healthier and introduce that concept to the household. So urban growers, urban gardening is medicine. Ngala sir se Minister Obiang ngilgar. So learning is fun. So this particular component of the project is very interactive. We see the caretaker really absorbing and very excited. Then we see the kids participate in harvesting and then talking to their the patient, grandma, what do you like this? So it brings that family interactive togetherness through So here, home improvement is a big chunk of this project, and it's awarded to our partner, but they're not here to do the presentation, so I'm going to be quickly summarizing. It's also patient, caregiver, family-centered, and when you change the floor or widen the door or fix the ramp, those modifications, structural modification, it does improve services, and particularly emergency services. So keep in mind that these are vulnerable populations, so their state of health is always at the edge of emergency services. So when we widen the door or improve the walkway for the gurney to wheel up in the wheelchair, it improves the safety for whole family and particularly the patient. But it also, the things that we don't really pay attention to is the caregiver. If we minister matuar sum kadam loli tial la chensa ulan modal madam dem gal lula modal itut engal caretaker kalobang kal dalal asabael gut makli el door salid. Okay, so part of the project is that we tend to leave less attention to the caregiver. So if the floor is wobbly and the patient is immediate area is not very stable, the caregiver is also at risk, and while they're doing their daily task to care for their loved ones, it compromises the safety on both. So it's the little things that we need to pay attention when we look at home improvement modifications. It also improves independence. So we have a couple of patients that were really wheelchair bound. But when we became part of the process to widen the door and widen the door to the bathroom, this person is actually very independent now. Naka full-time caregiver ngid elang. Namos of LDNG. So the patient gains independence when we augment the environment and improves their health. And it just improves the safety. So physical structure modification is also medicine. So this is some of the things that are in action. And life coaching, and none of these life coaches want to come up here, but I'm also a certified life coach, so I'm going to be another hat. But this is what they go in. The musicians target the patient who's have a limited mobility because they start seeing and the auditory and the feeling good. What life coaching does is targeting the caregiver and also other family members. So, family wellness and community wellness. And when we give that courses in the household level, it improves physical and mental health. Earlier, somebody was talking about stress. And so when we improve the health of that individual, that caretaker, physically and mentally, it improves their health literacy. They're going to start asking more about how to take care of themselves, how to take care of their loved ones and the whole family. So when that literacy, health literacy improves, it lowers the healthcare cost. And when we don't visit the clinics and the hospitals, we become happier person. So certified life coaches are also practicing medicine. And so that's a caregiver to a life coach. And they become really good friends. So now I would yield the floor to Vanessa, who's going to give us everything about what they see from the social approaches to the patients.
Militas well. So Baat, I will speak English, so it balances it out a bit. Okay, my name is Vanessa Aspang. I'm a home health nurse at the Palau National Hospital. Home health is the unit under public health department. Director Sherma Darisa oversees our unit. And I work with two other nurses. There's Ms. Kathy Quinto, Ms. Laylin Raklay, and our physician is Dr. Sylvia Osar. Unfortunately, they weren't able to make it, but hopefully I'll be able to represent. As you've heard and learned from Pearl and Baat for the last couple of months, we've been working with Palau Wellness Center very closely in bringing other social services into the homes of our patients. Our patients are very unique. Most of our patients are limited in mobility. Some are bedridden. They could be social factors that prevent them from coming to the hospital. And our goal is to do as best we can to bring the medical assistance and possibly social services into their homes. And, okay, there it is. So in home health, in healthcare, we have what's called a holistic approach in patient care and treatment, and we understand that very well in home health. We go into the homes of these patients, so we understand, like what Pearl says, we understand that the environment is very important in their well-being. Their family members and their caregivers, because a person in healthcare, we don't just focus, if we think holistically, we do not focus only on the illness, but all the components and factors that affect this one whole person. gida other bela o them dangil mo. Hindi kadil ka o nga niyar adam mar bibir ka o mar dalam. And then we have your home and your gablil and community, and it's so complex. And so it's a really tricky work. But it could be accomplished. I'm seeing that with Bella Wellness Center coming in. They've addressed the importance of environment modification, structure, and just promoting, finding ways to improve the environment, the living condition that is, healthy for the person, and not the other way around, where it could cause harm and deteriorate the patient's health. They've addressed nutrition. Ba'at and his team, all our patients, they keep calling us and telling us, harvest. They want to share their stories with us on what dishes they made in soup. That interaction is, I as a nurse in home health for 6 years, probably haven't really seen it, because we're so focused on taking care of the patient that we don't really see. We know, we understand the caregivers, we cannot neglect them, their financial situations and their environment, we have to be in tune to that. But sometimes we're limited too, and we're so grateful that this project came in to kind of help us through that. When we talk about psychological, social, emotional, spiritual health, those are all part of those components that make up this person. And I see that through the music. There's clapping and dancing, and some that I didn't know could jump out of their wheelchairs. And then one lady, one of our patients called me, I think 2 weeks into the project, called me and said, "Mal dio bubu, diamral dio bubu rabekal elbekal sales makkel maashal." We're working on it. That's my hope, that this gets stronger, expands, progresses, and becomes very permanent and very solid as part of the operations in home health, because we need that, okay? In home health, a patient's well-being is our priority, but we cannot do that without supporting the whole environment around that patient, the caregiver, the family, and all their situations and circumstances. And if we could do that, we'd improve the quality of life, not just for the patient, but the household. I think that's our goal in healthcare, is to really reach out to as many lives as possible and improve the quality of their life. So I think I've summed up. That's good? Okay, thank you.
So it's a service access, Minister Udoy, thank you. It's a collaborative effort, a new synergy with people on the ground, and then going to the home and see that success story, what the nurse says. So we took the opportunity, Minister Ngiray, to look at economic wellness through our work. So I know you talk about big numbers, but we don't talk about numbers, Udoy. Minister Udoy. We talk about policy, human health protection policy. And that goes to where thus we meet the basic needs at the homebound or the vulnerable population, household level. And how do we improve that access to services? May it be the nurse with the Band-Aid, or may it be the music, urban garden, or home improvement, and whatever other services that we're going to define. And when we look at those, we improve the health equity. And health equity is something that we love in our work. Because when we look at health equity, then we're looking at lower health costs. And we are so fortunate to have a system here, like a healthcare fund, So when we use that to look at other ways of forging pathways to serve our population, then we become a happier people. So at the end of the day, somebody mentioned happiness is an index. Let's start with just one household at a time. Let's rock and roll, ladies and gentlemen. So it's living with dignity. It's going in there, and you will be surprised that we're not nurses, but we get up in the morning and we meet and we have this new energy to go to this household. And we talk about them with so much pride because they're 99.9% Palauans. Komaral masulang, emal, there's a lot of people on the ground that put these folks together to bring that service. So thank you, and we still have that obligation as an NGO to look at the first three SDG as are part of our guiding work principle. So, everybody get up, because we have a closing song. And ladies and gentlemen, again, Edward and Luis from Palau.
Lila Magida Matyang Bagora del Morata ang Baririkli Kawagi Masangya sa alira alati Madilo bunga malagara bagi ko Matadawal meliwek kalmeliwek
Vice, ay lomingitak la dire kalurior. Lagi mo research sa alitak sorry adara apply. So we have to learn. These musicians have to learn these old songs that on loud from the older composers. So thank you.
Madam Sulang Pearl, Mabella Wellness, can we just give them a clap, a round of applause? Madam Sulang Pearl and the team, Dr. Yano, please give our regards. We'll go to output 3, which is Adila Sengo. Okay, thank you. Madam Sulang. Tira Santi Asanumam Bertier, Eruk Pesquitsa presentation Rabango.
Msulang Meget, nga kamal beto ka haulugungek hindi ngartel alsil sel bango. For those who have not heard of Bango, it is Palau Association of Non-Government Organizations. Now, let me just give a backdrop of what Palau is. We have created a culture where we rely on our government for virtually every activities within our community. But now this is a different approach where resources and assistance outside of the government can reach the community. I would like to highlight the aim of Bango by recalling one simple man several years ago who passionately appealed to those who are in power and with resources to make actual changes in our community by saying, "Ya alik, aku lingit kami melaka mongoyas, aberdil, adalom, ebay mongoyas, aigel diesel." Literally, he appealed that those who are in power not give their fertilizers on the treetop, but rather to direct them to the dirtiest part of the plant, which is the root. Now, that cannot so much say what needed to be done here, and I think that very much says what we need to do. And this is what Bango is all about, empowering the community. We have many benefactors. One of them is ADB. And we have recently adopted this campaign on no silence on violence. Hindi ako po pang ialuk, rarugutoy, raribebirigid. Most especially the vulnerable among us, namely single mothers, children, and those who are with disabilities. Now, Bango, with the assistance from ADB and through the Ministry of Finance, also with the partnership of our Ministry of Health and Human Services, have to work together and be the voice of these vulnerable among us. And not just nice policies that are in the halls of Congress or are in the formalities of the offices and agencies of the government, but rather be with the people on the ground in the community. And so we are very happy to finally hear United Nations to speak of hope, and not just all of these very formal, high language that are far beyond the common people in the community. I am very happy to hear that lounging here today, and also very happy that ADB, for once, or at least in my experience, is very humanistic in this grant, recognizing that we need to empower the people first if we're to talk about national building, let alone the economy of the country. So Bango is not going to do the work. As we have met with the traditional leaders yesterday, we appealed to them that there are many kinds of assistances that will not come through the government, but only through the channel of NGOs. and that we begin to empower our communities. And we are very lucky that we have all of these traditional organizations within our communities throughout Palau. And so we appeal to them that for them to reach out to Bango. Bango will only act as a secretariat. It will not do the work for your organization. But we will canvass, access, resources, and assistances to make sure that the goals and the objectives of your organizations within the communities are met. One good example of this is in Ngurusar of Ira State. The young men of Ngurusar wanted to find something that will gravitate or glue the young men of the community together. And so they sat and decided that they needed to build a canoe house, Diangala. And Bango was able to access resources and directed it to them. So today they have built that canoe house, which in turn have built solidarity within that community. That's the goal of Bango. So again, Bango will only mechanize all of these assistances, and we will be able to channel them to the organizations, social clubs and organizations, community-based groups within Palau, and so that they can access these various assistances that out there. Now, we realize that one of the setbacks for all of these organizations are the formalities of record keeping and making the required reportings to the granting agencies. Bango has already employed the expertise of Sylvia Klolubak, who is the one driving our campaign within the community. We are open. Anytime you call us to come to your community, we'll come, nighttime, weekends. We will meet the community at their convenience. And we've also hired a young lady who is a specialist, marketing specialist, because we know that most of these organizations in the communities will not hear of the formal announcements that are normally made in the government channels. So we are going down to the community and to reach the people on the ground. Once again, I'm only here to invite the community and all the people who have dreams of empowering their organizations to reach out to Bango, because help is only within your reach. Thank you.
Mansulang Isanti, maybe we can hold the questions until we have Kale Ongli. I'll invite you to give a brief presentation on Output 2. Thank you.
Ali. Good afternoon, everyone. Thank you for your attention. And we were so happy that we started off with wellness, so we are energized. So please stay with me. I'm with Output 2. My name is Ong Lee. It's short for Ongalib. And I'm with the project from Palau Visitors Authority side. That is, the aim is to with this in 2 years be a short-term intervention to drive our already existing government agencies and our supportive partner agencies in agriculture to really drive and increase the production. And first off, we're looking at taro production. I don't know if you were able to take some time off today and you got to see the taro patch, which is just around the corner of our cultural center. And that is our bread basket that produces our traditional foods, which is taro, that's kurao. And we want to reiterate again and thank Japan for the funding, because although today we ate rice, maybe next time we will eat more kurao. Yeah, and this is perhaps to just touch base before on from Mr. O'Keefe in his presentation as a way forward as a tourism plus. So can I be excused and just speak in Palauan, because this is, and you could really see majority of the gender around the room is women, and that is a lot of us, our aunties and our mothers, who are the actual traditional and future driving force of our agricultural production that we hope will be the economic diversification pathway moving forward. So if you can see in the slide, there is in the middle is an example of a vision of where we're trying to do, or with this project be just the beginning of moving and helping our women producers who were highly affected during COVID without the tourism being the driver of marketing to purchase a lot of their produce. Let's say in our planning and in our interventions, we will be able to say there is a Palau taro pancake mix, el tob that are mas rangaramasigta, or arangarayray. You know, it's we're working with women groups. We're working with women groups. El emeraldi mo malisi raurele laklol am tenmol nga seu rar adarasers. El toguni ardi rababaldab emlo mata arbasarir rateme la pandemia. Malwaise ya output tu radi el selak maldi erurak amaldi mo al nga seu el mangid brar al dabe araradi raigal darstal balu. Mardarstal adrasers malabo lola maklol sers malub etogi sa makleir radi gugaw. El tirak raosingel obis raser sa Bureau of Agriculture. El increase production, maluo laklol dangul harvest, mosabed el mesang al process ringi e oturur luul diklol madalaudod el moraraw magit. And in preparation for our economic recovery. Next slide. So while we are preparing for tourists with our made in Palau product, and here are our potential local buyers that we look forward to selling the big harvest that we project in just next year. We need to talk to our local large procurements from West, Suranga Supercenter, hotels. If any of you stay in Penthouse or visit Penthouse, try their taro bread. And also through the Ministry of Agriculture, because schools now are year-round, and also our great partner, MHHS, Ministry of Health and Human Services. Next slide. Ma obis rasers logi utialnges wa amo omgador amo domgador ngit mong Agricultural Support Center. El wal tul kakaros sen madal amorngi el mayo babato kal dalom el runner seri sel le oiska maguk Omagadoor Ramo Food Processing Center, elngi amo bees el building, mamasil elngi amo door ra obis raser serang SR. Ogyutial project, tiklug tel reiterate, smisi ilwasay, domes rakukaw ekmong mawangarang bodoru la value added, Lotteru, long term, domes gurgi, then mga made in Palau product. El galed, el Lotteru, diversify economy, not only lomes export, but also to our diaspora. So, tagi damal this yasing ra timeline narigid. We started in July. Recruiting our food producers, which you will be able to see them receive some of their seed money today. And then some of the groups have started planting in August, and we expect at the time when the building of the food processing center has been constructed in March of 2023, we will have also in tandem our first harvest. And with that, we have plan A, plan B, plan C, just in case the center is not up yet and we don't have the equipment yet. We will work really hard with our local restaurants and schools to see how we can get them to really buy the taro and really make food security to the plate of not only homes, but also schools. And to conclude, in the last slide, that is next, are some recommendations that have started to emerge. Etiamal dimor tirgagi del adra klol am tel ngartiang. Yada sisil time. Oh, komeng. Malway say, yak kulngit tamaklol am talom das logardi ala expert tara hasap. El may malosis akli dan mobatok al ad arole la hasap. Ngara hasap. HACCP stands for Hazard Analysis Critical Control Point. El sedel considering il best practice ra food safety. El seltal dangul may eng masab edel practice ringi roguy madaruli a product dotorul marar tourist and sa edel direk kal dotorul startel export. Rakuk maybe in 10 years. Aroy the time and ya the lungungil ada start alam das ringi elang. Ya ongeru ataraw das wal malut kan mool nga sew ay kal siopay ra marulkal abadengela agora subsidy malub etoklol amt el lomu sakal mesterir al dabe el walgora preferential treatment scheme el lomu sakal lertir namara la director igeda dik malungi lengle mangmlekot el lomu ra aldu el lomaklat kargi the marngara al dabe el wasaka dingya del mongil el mesal waseng makarang eten maran mel tax el dirakal mo al ngasew ay kad shopan moklol sab el maarar el gira le kana mirgid mal ngarnya karmi weng akartiang mal ngarnya karmi wedi mo kaya ko masula temiu.
Ma'am Sula Ongli, this wakal din mo telaw ay sa igal number sa gida mo sa beedal mes et track out of output 2. So anges wa mo o sa beedal lot of the close to or target gida 900,000 producers sell resilient crop per gida blue bela which is kukaw taro. Esel mlamatut kalgid auspe eringa kaseng aswas. Direkan mo sab edel mesang aldisira 20 aldabel or 300 women aldabel Direk aludi mo karsal direk and will receive the seed grant of 10,000, and that's just purely for expansion of dry land taro. Kita traditionally kada malal ramasay ma igel blol nga ral maringi hindi kita direk global mera dry land taro hukmora sayers. Most of it mesang sell aerial data of how we expanded our agriculture, and we're working with our monitoring and evaluation firm who will be helping us establish the baseline as well as the expansion. Most of it will distribute 1,000 to 1,200 farmers. Bureau of Agriculture, PVA, Palau Visitors Authority, because that creating a new market is a very important output, and that means we're working closely with the women to do training, not only training in agriculture, but entrepreneurial as well as business, to do record keeping so that not only our women, but our young people to learn how to record everything. So in moving forward in everything in terms of food security and income generating. So I think that's going to be, that's the last of our panel presentation. Minister Udoy, we're going to be moving into our awarding ceremony. We know that Ambassador is here. So I believe our members of our project management unit, okay, we're going to, Alphonse is just telling me that we're going to have a special message from our Deputy Director. So we'll have a short message from you, and then we'll move on to awarding. Thank you very much. So we welcome your presence on the stage.
Thank you. Thanks for welcoming me back. Not wanting to take too much of your time, and very hard act to follow, clearly. I'm not one for singing and dancing, so you're just going to have to hear. I think you've heard all of the details of the amazing work that the project management unit is carrying out. Coming from ADB, we're really happy to have managed to coordinate financing for that. Our friends from the government of Japan have been extremely generous with their grant for Palau for this work, and there's also some grant financing in there from the government of Ireland as well. So we've managed to pull that together and really focus it in on groups that perhaps haven't necessarily got a lot of attention from big development partners like us, but at a time when the assistance was really needed. We've done this work here, something similar going on in Vanuatu as well. We hope to learn from both of them and see what parts we can pick up and carry on elsewhere, perhaps in other countries. And I know government is also looking to see what works, what's interesting, and what might be sustainable going forward in the long time. But I think we've all heard really interesting stuff coming out of that, and I'm looking forward to having a chance to see it in action on the ground in different places. So thank you for joining us this afternoon.
So may I ask the project management unit staff to bring up the awards so we can set them up here. And I will invite His Excellency Ambassador Karasawa Akira from Japan Embassy. And the Honorable Minister Caleb Udui Jr., Honorable Minister and Vice President Udu Senor Sangabao, please. Thank you. And Honorable Minister Ngiray Balasat Matuul from MHRCTD to come while we call, as well as Deputy Director General Emma Veve to come and join us as we call the women who went through a rigorous application process First, the women had to show that they were COVID impact. They had to show that at least 25% of their membership was of low income. And in Palau, we gapped that at 13,000 and below, but it's still too high. But that was used. And they had to sign an MOU and present an action plan and say, yes, that this is what we're going to do. We're going to sell back the seedlings. We're going to sell back the corn. So we thank you very much for having to do that. And we thank Minister Uduy and the tax office also for allowing us to do some, for them to be able to receive. So there is a way, even if you're not like a registered non-government organization. We ready? So I will call the governor of Aimalik State, the representative of Maltreng, Palau Taiwan Farmers Association. Those two are the recipient of the 10,000 Women Seed Grant. So could I have your members, please? Tombrot. Just smile. Thank you. Lakmam kadong Governor ay state as kumangartyang but aldabe ngara progor yaktire kaldi OCC kasangara ses so patira idar masangartyang tiga dire kal ngilu asel ku kwantertira July na madal malir. We have another group ngara ses from Irai. They've received their grant and so they've started to plant, and also ngarab ood. But today we'll be awarding to ngarab progor. Thank you. Yes. And yes, if Ngarases and Ngarabood want to join, why not? This is so. Thank you, Tokal Mas. Como otis en klela grupo kamiwe, masyasing ang. All right. Bukul ngitras ko mga Governor ang Arart State, ang Artyang. Yes, I know Governor Sharp sa kumang Artyang. Malong tirmal may, aldabe era dil nga bukod incorporation, Maxid organization. Maxid. From Arart State. Yes, there's men. That's right. They will receive their own, yes. really good. Tumok. All right, thank you. Sulang. Ilak mo mo to nga great state of ngar along state, tas kumakavernor ang artyang, tas mga artyang. And then, tira ka mo mga three are members sa Dilisor Agricultural Association of Ngar Along, ma NEC Dulos Youth Organization. But please say me yatong shasin yatong chikagid. I don't think so. Yeah. Yes. From the right. Right. Thank you. Ilak mom kadongi omteera Governor Ngartmau State, Jennifer Ngiraiwet, ma omteera Olbil, malbol sab Irel May, mar maasra ngar egil. Congratulations. Ilok mom kadongi sumartang Governor ang SR State. Mabungal kalaw. Yaw ay sa kasi ang aratalo kami kuksara July at ngiluwa si Grant 30. Right. Yes, Senator. Good job. Ang teera great state of ng SR. O ma minister. Minister already hindi ang teera mo. Thank you. Ilakmol ngitra Governor ang Iwal State. Malamay ngi ngaraboes. Sa eldabe ang ngaraboes si Maliwal kadamal mirang asule la maas Lorenza tirge kuknilu sel kwanter tirsa July. Again, again. Thank you. The last but not the least, the great state of Ngaramblangui. Our governor is here. Walngit dir turong mar ngaramsik mar ngalakasol. Malambe malngaya seat grant 30. Yang kal tinang ko mal na mufto kam. Oh, ngaramsik dir turong. Ngalakasol is the C1. Talgib. Talgib. Thank you. Thank you, ministers, Vice President, and Ambassador. So thank you. That concludes our awarding ceremony, and that's we have Ngatpang State. I think that will be our third and final awarding. That's going to be Ngatpang, and we didn't mention here, but Ngara Otelo from Malgayok State also received their seed money in July. So thank you very much, and thank you, Rogul Maas, Rangalgir el Mosub Ilo Taktirin May, despite the weather, Maaroy. So thank you very much, everyone.